Well, good afternoon, everyone, and thank you so much for joining us here today. My name is Sarah Moore. I am the social media specialist for Prisma Health, and we are here today for another Facebook Live Town Hall panel discussion on a topic that affects a lot of us. It affects a lot of our loved ones, and that is Alzheimer's and dementia. So as the US population is living longer, folks are living longer, we're also seeing that the complications that come with aging, those are affecting more and more people, and they're affecting more and more families. This is also putting a strain on a lot of younger family members, people who might be kind of in that in-between generation, taking care of parents and their own children. And it's putting a lot of strain on those folks who are caring for people who are dealing with these really difficult effects of aging. So all of that is to say that Alzheimer's and other forms of dementia are very complex conditions that involve care from a variety of specialists, a big care team. That's everything from primary care and geriatrics to behavioral health to caregiving support and support for that individual that's kind of experiencing this disease. So today we're excited to bring to you a panel of experts to discuss this important topic. We're excited to have all these folks here today from all of those specialty areas that I just described. So today, we will be answering a few popular questions that we know the community has been asking. And then if you have questions, you, our audience, we will take your questions live. So if you have questions, put them in the comments of this video, and our experts will be able to answer those here today. And I think with that, we are probably ready to get started. So like I said, we have a great panel here for you today, and I'm going to actually have them introduce themselves because they all have so many great qualifications and are very well versed in this area. So I am going to start with you, Dr. Clark.
Good afternoon, everyone. My name is Frank Clark, and I'm a general adult psychiatrist. I practice in Greer, South Carolina, and I'm on faculty at the University of South Carolina School of Medicine in Greenville. Great to be here with you all today.
Thank you. Dr. Nagar, I will ask you to go next.
Sure. Hi, everybody. So I am Dr. Anu Nagar. I am a board-certified geriatric psychiatrist. And just like Dr. Clark, I am in the Greer Psychiatry Residency Program on faculty here. In fact, I'm the program director of the Greer Psychiatry Residency Program. And I'm also on faculty at the medical school, USC School of Medicine. So thank you for having me here today.
Great, thank you. Next we have Dr. Nayak.
Hello, everyone. I'm Dr. Nayak. I'm a geriatrician in Columbia, South Carolina. I work at a practice called Senior Primary Care Practice, and I spend most of my time practicing primary care for patients over the age of 65. But I also run a memory clinic 1 day a week, and that is designed to help primary care providers help manage their patients with memory loss. Thank you for having me.
Great, thank you. Dr. Palmer?
Hi, Dr. Mike Palmer. I am a family practitioner. I'm and medical director of the PACE program across the Prisma Health System. I have duties in both Columbia and the Greenville market. We have 5 centers, and I have a number of both nurse practitioners and physicians that work with us to provide the all-inclusive care of the elderly. Thanks for being here. I'll tell you more later.
Wonderful. And last but certainly not least, Dr. Srinivasan.
Thank you, Sarah. Good afternoon, everyone, and welcome. I'm Dr. Shilpa Srinivasan. I am a board-certified geriatric psychiatrist and general adult psychiatrist in the Columbia area. I am on faculty with the School of Medicine, and I have been practicing in the Columbia area for the last 15 years. And I'm a professor of clinical psychiatry. Delighted to be here, and thank you for the opportunity.
Great, thank you so much to all of our wonderful panelists. Well, now that we know who you all are, we will go ahead and get started with some of the questions that are just kind of set the scene for us here this afternoon. So the first question is for Dr. Nagar. And I just want to make sure that we are all on the same page about understanding on a basic level the conditions that we are talking about today. So Dr. Nagar, can you share more with us more about Alzheimer's and other types of dementia? What does it mean when we say someone has those conditions? So you're on mute.
Sorry, good thing I didn't launch into that.
Yeah.
So dementia, is a really general term. It actually comes from the Latin basis for the word is actually demens, which is without the mind or without thinking. So that's what generally the term means. In the medical community, we've kind of stepped away from using the term dementia. We have stepped more towards calling these disorders that really affect a person's cognition or their intellectual ability. We've started defining this as neurocognitive disorders. So there's a greater umbrella. So if you find your doctor saying, well, I think that someone in your family has a neurocognitive disorder, more than likely they're talking about what the general population would consider dementia. So I think that's important to know that the terminology has shifted a little bit. And so, that's a good starting point. Now, like I said, a neurocognitive disorder is anything, any disorder that can cause a change in a person's intellectual functioning, right? This could be due to a stroke, this could be due to medical illnesses, but most commonly, this is due to Alzheimer's disease. It's the most common cause of a person, especially an older person, suffering from a neurocognitive disorder. So what do I mean when I say neurocognitive disorder? There's actually 6 domains that we look at when we're trying to diagnose someone with this broader umbrella of a neurocognitive disorder. Memory is one aspect we look at. Language is another aspect we look at. A person's ability to plan, so we call it executive functioning, is another. Language, executive, attention, someone's ability to continue doing motor functions such as putting on a belt, driving, those kinds of things. And then social capabilities, how to act in social situations. So in Alzheimer's disease, what we do know, which I think the general population equates to someone having dementia, is that the ability to learn new information and to capture memories is what starts to deteriorate. So the first few things people would notice are changes in memory. So Alzheimer's dementia is a type of a neurocognitive disorder. You may have heard other terms like frontotemporal dementia or a Lewy body dementia. So it's important to think of Alzheimer's as a cause for dementia. It is not necessarily the only cause for dementia. It's the most common cause. I can get into a little bit about the actual, mechanism of what happens in the brain when this illness happens. But I don't know how much detail we're delving into at this point. So we can always revisit, what happens.
I think that's a good kind of setting the stage in terms of, all right, what are we really talking about when we're talking about these things. So thank you very much for that. Kind of along those same lines, thinking about somebody who is just kind of living their everyday life. We all forget things from time to time. And I think that, that kind of increases as we get older. We all have days where we're just kind of confused and lost and don't really know which way is up. And Dr. Nayak, I know you deal with this on a daily basis in your work. And so want to direct this next set of questions to you, which is, and Dr. Nagar did a really good job of setting this up for you. Kind of what are some of those initial signs of dementia, and when should someone be concerned versus what is just kind of normal? So we'll start there.
Yeah, so I often tell families and patients that our memory is the best it's going to be when we're in our 20s, and then from then on out, there's going to be some change. So yeah, teasing out what normal aging is versus a major neurocognitive disorder can sometimes be difficult. And individuals vary in terms of what symptoms and signs they may present with. Partly, that might depend on the type of dementia they have, but I'll talk about some of the common signs that we see. So, and Dr. Nagar touched on some of this as well, but the big thing is memory loss that affects day-to-day function. So you may see people repeating the same questions, repeating the same stories, difficulty remembering names, dates, appointments. Some may have significant difficulty finding words in a conversation. We also see impaired judgment. We often see limited insight into one's cognitive deficits. And one of the first things that I think most families will see is difficulty performing familiar tasks, such as driving, managing finances, preparing meals, taking medications correctly. I heard an expert once say that these individuals lose first what they learned last. So anyway, you can also present with changes in mood, behavior, and personality.
I like that's a good kind of quote to frame the topic. So if somebody is experiencing this, or they notice that a parent or another loved one is experiencing this, do they go to their primary care physician? Do they need a specialist? Kind of what are the steps in figuring out what is really causing that?
Yeah, absolutely. They should go to their primary care doctor and discuss their concerns. And if they're seeing any of the things that we've talked about so far, I think it's worth bringing up. The different primary care providers have different comfort levels in dealing with this. And so if they don't feel comfortable or have the time to address these, because this is a time-consuming diagnosis to deal with. It's not just, diagnosis of the patient. It's not just treatment, but it's addressing safety issues. And so not all primary care providers have the time to address those needs, especially when they're managing all the other medical problems the patient may have. So, in those situations, I think the specialist is warranted. And there are also other situations where I think a specialist is necessary. If a patient is presenting with symptoms under the age of 65, that person probably needs to see a specialist. If there's a question of whether or not there's an underlying psychiatric disorder, that person also may need to see a specialist. And then if the patient seems to be rapidly progressing, I would consider that another situation where they may need to see a specialist. And the specialist can vary, it could be there are memory clinics around the country. So it could be a memory clinic that's run by a neurologist or a geriatrician. It could be a psychiatrist. There's also neuropsychologists who do very extensive testing, and they can help tease out, is this, more psychiatric, or is this more neurocognitive?
Great. Thank you so much.
Yeah.
So we've talked about, how to kind of get to this diagnosis of Alzheimer's or a neurocognitive issue. Once someone has been diagnosed, that's a hard diagnosis for the person. It's a hard diagnosis for the family. And so I kind of want to talk a little bit about the behavioral care aspect of that, and kind of what is that patient experiencing, what are they feeling, and how can their loved ones really support them? And Dr. Srinivasan, I'm going to ask that question to you.
Sure. So I think both Dr. Nagar and Dr. Nayak have really laid out very nicely the process that ensues and what this condition is. One thing to realize, and it's very important for not only all of us in healthcare, but all of our patients and families to realize, is that the diagnosis of dementia is the start of a journey. And this is really about a journey. The process that dementia takes is a continuum where things can change. And it really depends on when the diagnosis is made in terms of how far along an individual is in their condition. Unfortunately, we know that not everybody gets diagnosed right away, sometimes because understandably so, some of these changes are chalked up to just aging, and things perhaps progress before they hit a point where family members or loved ones realize that maybe this isn't just aging, and that's when the diagnosis is made. So in terms of what an individual with dementia can be experiencing at the time of diagnosis can really run the gamut. Depending on whether they're fairly early in their diagnosis, meaning the person with dementia still has some awareness of what's going on and perhaps some awareness of what's changing. The diagnosis of dementia can be scary, it can be alarming, it can be anxiety provoking and nerve-wracking, not only for the person with dementia, but for family and caregivers as well. And that's why navigating this journey from the point of diagnosis to what's next and what lays ahead is really important. And that's where the real healthcare team, including the primary care provider, as well as any specialists involved, is really critical. This is a condition that doesn't just affect the person with dementia. It's really a condition that is felt and experienced by family members, loved ones, and caregivers. So they are really at the crux and at the center of that team. The person with dementia may experience other symptoms. We call them behavioral or psychological symptoms of dementia as the disease itself progresses. We know that anywhere from 2 out of 3 individuals with dementia can experience some type of this symptom over the course of their condition. This can take the form of sadness or depressed mood, or even depression. It can be anxiety. It's not unusual for persons with dementia, especially as the condition advances, to experience what's called apathy, where it is difficult for the person with dementia to really show interest, motivation, or desire to do things. And this can be a tricky thing to navigate because sometimes it can be misperceived as laziness or not wanting to do things, but it's really about the underlying disease process that interferes with their ability to plan, to initiate, to start an activity. As Dr. Nagar mentioned, executive function can really be impacted. So it's very important that we're attuned to these changes, that we really equip our family members and caregivers of persons with dementia to understand where these conditions are coming from and how to approach and manage these in the home, as well as how to approach and manage these in concert with the healthcare team, so that the individual with dementia and their family and caregivers can really have the optimal quality of life as we navigate through this condition.
Thank you so much. That's really important information for folks to know. And I'm glad that did our audio get crossed a little bit?
Yeah, we did. We lost you for just a second, Sarah, but you're back.
Okay, am I back?
Mm-hmm.
Okay, good. Awesome. Well, I'm glad that Dr. Srinivasan brought up caregivers and how taxing this can be on them and how important they are as part of the care team, and also the need to care for themselves. And so Dr. Clark, I'm going to move to you. And I want you to talk a little bit more about that. I mean, this is, as Dr. Srinivasan mentioned, this is an incredibly difficult diagnosis, not only for the person, but really for their family, for whoever is going to be a caregiver to them. So talk about that a little bit from a behavioral health perspective. You know, how can caregivers make sure they're caring for themselves in all of this, and what can they do to really help themselves here?
Thank you for that question, Sarah, and my colleague and friend, Dr. Srinivasan. You know, there's a good segue. She started off talking about how the condition not only impacts the person who's experiencing it, but it does impact the family. I can speak firsthand to that as a psychiatrist who has a mother with a neurocognitive disorder. You know, even though you understand the disease process, so to speak, and you study it, you've seen patients with it, it's one thing to care for patients, but when it becomes when it's a family member that's close to you, it can evoke a lot of mixed emotions. There can be anger, there can be denial. It's kind of almost going through that grieving process, so to speak. And so one of the things that I share with caregivers that are caring for individuals with neurocognitive disorders is what I would share with other people, with individuals with other disease process or conditions, is self-care is extremely important. What we know in terms of research is that individuals who are caregivers for their loved ones with neurocognitive disorders are actually more it could be more stressful than caring for individuals with physical disabilities, just to kind of provide some context there. And so I think it's important for caregivers, one, to seek knowledge and understanding of the disease process, so to speak. There are so many advocacy groups, support groups. The Alzheimer's Association is one that I definitely want to plug, because I think oftentimes caregivers feel somewhat isolated. They feel alone, and, you know, am I the only one that is experiencing that? And what I tell people is no, there are tons of resources out there, but I think it's important to make sure that we disseminate this information to the community and to the caregivers that are caring for their family members. Self-care is, I would say, it's tailor-made. You know, it's for the individual. I know for myself, running and prayer and spending time with my family and writing poetry help fill me up. That might not be the same for another person. So when I'm speaking to individuals who are caregivers, I encourage them to find things that are going to fill their love bank, so to speak. And that looks different for everybody. But I think the most important thing is that not neglecting that self-care, because again, you have a person who is experiencing a neurocognitive disorder, but again, we have to be mindful that the caregivers, there can be a psychological impact to caregivers, there can be a physical impact. There are studies to show that individuals who are caregiving are at risk of developing depression and anxiety. They also may develop some physical conditions that they may have not had prior to being a caregiver. And then also, you know, the financial impact that it can have on caregivers. You know, we meet people from different walks of life, some that may have the financial means to have that support where you have home health come in, or other resources in the community. Not everybody has access to that or the funds to afford that. So again, I think it has to be tailor-made for the individual, but then also making sure that we provide as many resources as possible, so that not only the person with the neurocognitive disorder can live their optimal life, we also want the caregivers to live their optimal life and thrive.
Absolutely. Thank you so much, Dr. Clark. That's such important information about how to really take care of yourself if you're someone who is encountering this in your own family, as I know so many of us have. So thank you for sharing. You kind of talked about resources for folks, and I think one of the resources that we offer at Prisma Health, and that, you know, is available other places, are these systems and programs like PACE, which is the program for the all-inclusive care of the elderly. And that is something that Dr. Parmer is quite familiar with. And so, Dr. Parmer, I was hoping you could share with us a little bit more about what PACE is, and then how that can help, you know, really patients with many conditions, not just neurocognitive ones, but how a program like that might be helpful to both patients and caregivers.
Sure. Thank you very much. Without a question, the PACE program is the all-inclusive care of the elderly. And I think the key words there are all-inclusive. And as I listen to my colleagues, to Dr. Clark and Dr. Srinivasan and Dr. Nagar, all of them have articulated that this disease, this condition is affecting everybody in the family, not just the individual that's being afflicted with the condition. The PACE program has a large wraparound services, and those services include an adult day center, where if family members need to work but they can't leave mom at home anymore because they're worried about her with the neurocognitive disorders, we can bring them into the center for the day, and so they know that they're in a safe environment. Here we have a medical clinic where we actually provide primary care for every one of our participants, and indeed also many other disciplines, including occupational therapy, physical therapy, recreational therapy. A lot of socialization occurs here, which actually helps to, in some cases, stabilize and improve their neurocognitive status. Over and above that, it is designed for people 55 and older, and most of our participants have Medicare and Medicaid. So if that's the case, then the program is truly all-inclusive and everything is covered. We have transportation that will pick people up at home and bring them to the center or to their medical appointments, and we're able to do that on a everyday basis. The center is open Monday through Friday, but we also have 24-hour care available at home, so that in the event that a person needs additional care, we can help extend that out into the home. The most interesting part, and I think as I listen to my colleagues talk about the neurocognitive condition, and that it is an evolution. It's not something that we all of a sudden, it's not like a big pain in your shoulder and it's there and then it's gone. It is something that evolves over time. And I think Dr. Nayak mentioned the issue of family members. Some will notice it, some won't notice it. And often it's a family member that hasn't been around for a while, comes to visit, and they see, oh boy, dad's really changed a lot. And so that often will trigger some search for additional resources. Over and above that, the goal of the PACE program is to keep people in their own home instead of institutionalizing them or in a long-term care facility. So whatever we can do to help those people stay in their home is the ultimate goal. And often we'll see the first contact that we have is when family members are just absolutely at the end of their wits. They've done everything they can, and now they're in the emergency room with the family member, and they say, we just can't take care of Grandpa anymore. He's too much for us. Well, the concept of bringing that care into the home and bringing the services in early is where PACE really excels, because we can adjust and individualize that care as the person's condition changes. The ability to fill that love bank, and I love that term, Dr. Clark. I think that really is something about self-care that we often neglect. But indeed, those ability to support the provider, the family members that are taking care of the person with dementia, that is probably the most key important part of what PACE can do. By providing that additional support, their family members are able to take care of their loved one in the home for a much longer time. Sometimes these people do end up still needing being placed in a skilled nursing facility or in a specialized unit. But at that point, the family members get to say, we did everything we could. We took care of them as long as we could. We added all the resources that were available. And at that point, I think it helps from a self-care standpoint. It helps them to avoid some of the guilt that we often see people pile on themselves for I couldn't take care of them any longer. So over and above that, it is a very individualized program. We look at each family member or family unit and participant as and are evaluated on admission again at 3 months, and then every 6 months after that, we go through a full interdisciplinary team evaluation of what does this family unit need in order to support their continued care in the home. That's probably a really good overall summary, and there's lots of nuances to that, I'm sure.
Definitely. I just think it's so important that we share the information about this program with folks who could take advantage of it. And we will put some links in the comments of this video so folks can access that if that's something that they are interested in. So thank you so much for that, Dr. Palmer.
Mm-hmm.
We've talked a lot about what happens when these conditions occur, how that affects the individual and the family. But I think one question that a lot of folks have, this is something that you hope never happens to you or a loved one. And so I want to talk a little bit about, is there a way to prevent this? Are there ways to ensure this doesn't happen to you or a loved one? And Dr. Nayak, I'm sure you probably get this question a lot in your clinic. So I'll start with you, but if others have things to share, I would welcome you to jump in.
Yeah. So, for some individuals, there's going to be a genetic component. And so there's not a whole lot, we can do about that part. But, I tell people, you got to be healthy, staying active. That means staying physically active, socially active, and mentally active. Those are all very important in prevention and slowing progression if someone starts to show these signs, especially when we talk about someone with vascular dementia. That exercise is very key. It increases blood flow to the brain. And then, there are certain medical conditions like sleep apnea, for instance. If you get diagnosed with sleep apnea, it's very important to get treatment for that, not just because of the lack of oxygen to your heart, but also because of lack of oxygen to the brain. So, for people that get this diagnosis and aren't treated, they're having repeated nights of their oxygen levels dropping and their brain not getting, that oxygen. So, that's very key treatment of sleep apnea. There's a lot out there about different supplements, and there's a lot of controversy, I think, about some of these. So fish oil, turmeric, coconut oil. Turmeric, I think, first came about because it appears that the Indian population has less Alzheimer's disease. And so they were trying to figure out, why is that? The thing that we have to keep in mind as well is that some of these changes that occur in the brain, or the changes that occur in the brain when someone has dementia, occurs years before patients start to show symptoms. Going back to turmeric, Indian population, that's a staple in their cooking, and so that starts from when they're children. So starting something like that at mid-age, I don't know how helpful it is, but these are things that probably don't have a whole lot of adverse effects. And so I tell people, in moderation, you could try these things.
Gotcha. And I don't know if anybody else has anything to add about possible prevention.
I think what I will just add to what Dr. Nayak just mentioned is, segueing off of the whole component of staying healthy. What's good for our body, what's good for our heart is good for the brain. And so it's really important that we see our health as not parts, but the sum of our parts. We don't have a steel plate that separates our brain from the rest of our body. So really looking at our health as something that's an overall holistic approach is really critical. And it's never too late to start exercising or to start incorporating these things of wellness into our day-to-day lives. So I think that's something that's really important. Also, there's a lot that's been talked about when it comes to brain exercises and mind games and Sudoku and crosswords. And the jury's still out in terms of whether these are truly going to be preventative. But the more important thing is anything that challenges our brain, anything that makes us think a little bit differently from the standard is helpful to keep our mental processes agile and active. Just like if we're building muscles in our body, if we just use the same 5-pound weight over and over and over again, we're not necessarily going to build strength and endurance. Similarly, challenging our brain in different ways. For some people, that may mean learning a new instrument or learning a new language. Or for some people, it may mean taking up a hobby or an activity that has not been part and parcel of their day-to-day lives thus far. All of those are very important, very helpful things to do to keep us intellectually, mentally stimulated and active, but also to keep us socially connected as well.
And I was going to say exactly the same thing when I was in training. You know, we used to hear this all the time. What's good for the heart or what's good for the body is good for the brain. I think maybe for just our audience to have something real concrete to look at, there is a diet that they can look at called the DASH diet, the Mediterranean DASH diet, which is actually, I think initially the data was mostly for hypertension, but as they've looked at how this has impacted people's brain health, what they found is that, you know, the Mediterranean diet, rich in olives, rich in olive oil, that, you know, cold water, fish, these things are actually, you know, in combination with exercise. Again, this concept of staying healthy, physically healthy, you know, really reducing alcohol intake definitely has had some, you know, and the jury was out on that for a little while about red wine, whether that actually helps. So these things are constantly shifting, but I think sticking with the bottom line rule of, you know, good physical health, no plate separating our brains. So, you know, good physical health includes good brain health, you know, which is all just preventive, right? So, yeah, I just wanted to say that about specific diets, because I think people find themselves kind of saying, well, is there anything I can do? Yeah, you can not smoke, not drink, stay physically active, stay socially engaged, eat well and take care, you know, take care of your bodies.
Yeah, and I'd like to add to that, Dr. Nagar, I think you summarized that very well. But one of the things that we've noticed in the PACE program, during the pandemic, we were pushed into a position where we had to lock down the center, and we were, when I say locked down, we weren't able to bring our participants in for all of the socializing, all of the other physical therapy and occupational therapy services. And what we noticed during this last year is that we saw people with neurocognitive disorders that actually declined more rapidly than we expected, or than they were previously. And I think that the key takeaway for us is that entire balance. You know, we were able to, when we can bring people in and we can get them to socialize and we give them a good nutritional meal, and are able to see them in the clinic to manage their other medical conditions. All of that helps to stabilize the condition and helps to slow the decline, or at the very least allows us to feel more comfortable with the fact that we're actively involved in doing what we can to help manage those situations.
Absolutely. Thank you all for sharing. I think you all are absolutely right. There are so many, there's such a desire to find a silver bullet to say, you know what, if I just take this one supplement, this will never happen to me. And it's just not like that, like so many things in healthcare. And that's one of the reasons we like to do these panels and share this information, is so people don't feel like, well, if they just take this one fish oil, they'll be okay. It's a little bit more complicated than that, but it is something that we can all work towards and work on. So one of the things that can be so devastating about Alzheimer's is that there isn't a cure right now. And it's a progressive disease. It is, non-reversible, I think, as far as we know so far. There's lots of research that's being done about, treatment and all of that. But speaking of treatment, do we have treatment right now? Are there drugs that could be prescribed? How do we treat this so it doesn't just kind of become a rapidly progressing disease? Dr. Srinivasan, I'll ask you to contribute there.
Sure. So yes, there are treatments, and as you rightly pointed out, there isn't a cure for this condition. This is not reversible in its true state. However, there are treatments, and there are treatments that have been very rigorously vetted and approved by the Food and Drug Administration, or the FDA. And those treatments fall into the category of medications that we sometimes refer to as cognitive enhancers, even though that's a little bit of a tricky term. But medications like donepezil or Aricept, which is the trade name, medications like galantamine or Razidine, rivastigmine or Exelon, and memantine or Namenda, these are medications that are often prescribed to individuals who are diagnosed with Alzheimer's dementia. And with these medications, what the studies have shown and what the scientific literature has shown with these is that they do not reverse the condition. They do not turn the clock back. However, they slow the rate of decline. They slow down the rate of cognitive changes relative to not doing anything at all. So relative to not taking any medications at all. These medications are not without their benefits, but they're not without their risks either. And so they may not be suitable for everyone with Alzheimer's dementia, depending on their underlying conditions and depending on their circumstances, and also depending on where in the stage of this condition that they've been diagnosed and where the person with dementia is along that continuum or on that journey. So it's critical that persons with dementia and their family members, caregivers and loved ones really have a dialogue, a conversation with their healthcare team, with their primary care providers and with the specialists to ensure that whatever treatment is prescribed, that it is appropriate for the individual at that time in that moment, and that's something that's being monitored on an ongoing basis. Very recently, just a few months ago in July, the FDA approved another new treatment, which is radically different from the existing treatments that are out there, and is the first new agent that has actually been FDA approved in almost a decade and a half. And that's a medication called aducanumab, and that is administered not as a pill, but as an IV infusion. It's so new that there really aren't a lot of centers and areas that have good protocols in place to kind of offer that, because there are lots of things to be worked out in terms of that medication. So this is the lay of the land, if you will, of what's out there. The bottom line, though, it always comes back to individualizing the treatment, to customizing it to the person, and to make sure that whatever treatment's offered is appropriate for that individual. And to also remember that medications are only part of the treatment. There are so many non-pharmacologic or non-medication interventions that are effective, that are helpful, and that can be meaningful for the quality of life of persons with dementia and their families and caregivers.
Thank you so much. I think that's just important for folks to know that, there are options. It's not, a diagnosis and then just kind of, waiting and seeing. So thank you so much. I want to go back to the conversation we were having earlier about caregivers and caregiving, and just again, emphasize how important it is for that support system and kind of the caregivers to have something in place to help them. And so, Dr. Clark, I'm going to go to you and ask just, what are, when you find out that a loved one has been diagnosed with this, are there, steps that a caregiver should take? Okay, I need these types of resources kind of in my back pocket. Here's some coping skills that I might need to work on, that sort of thing. Are there kind of tangible steps that we can give folks who might be experiencing this in their own life, for kind of how to be a caregiver and how to cope?
Absolutely. So, I think, again, going back to it takes a village. And I find that having a care team that is multidisciplinary, so to speak, can be very helpful for caregivers. So, for example, there are a lot of therapists out there that specialize in geriatrics. And so I think that would be, a good place to start. Oftentimes, I think there still is a stigma, I think, when it comes to mental health in general, and then, asking for help. So, I would encourage our audience members that asking for help is a good thing. It is, and vulnerability is important, especially when you're being a caregiver. So, I would seek out, I think, talking to the person's primary provider of what are other resources available, and then connecting them with those resources. But, if someone is not comfortable really reaching out to a therapist, again, the support groups are very vital. I can't stress that enough. So I would definitely encourage people to seek out those support groups. Again, the Alzheimer's Association is this one. There are many others out there, and I think there's something therapeutic to be said about being with people who are experiencing or going through a similar situation. Again, we don't have to operate in silos, and I think a lot of times when caregivers are going through, you have to think about caregivers. We take on multiple roles, and so it can be very, if you're a spouse, you have children, you're working full-time jobs, there's so many roles, and then you're adding this other role to your plate, so to speak. It can be very stressful. And again, we kind of have to know what our bandwidth is, and when that tank is running on E, we don't want it to get to E. We want to intervene before it gets to E. So maybe at a half a tank, maybe. But reaching out to those individuals and then surrounding yourself in those support groups, I think that is the best advice I would give our audience members.
Sarah, I wanted to add something
Sure.
In that, just because I think some of us in terms of geriatric psychiatrists that have done this for, in my case, not very long, but have dealt with families. Again, I think everything Dr. Clark's saying is so important. I will add, again, something a little more tangible for family members, because I think a lot of people feel lost in terms of where do I start? For a lot of people, that starting point's hard. I think Dr. Clark's mentioned starting with your primary care, because the one of your biggest resources and friends going to be the social worker in a primary care's office. So, getting linked with some social work services who can then guide you on where to go next, because it is overwhelming. Or, starting with something like the Alzheimer's Association and asking them where we go next. But I think a safe place to start is the clinic where your loved one was diagnosed, and say, what are the social support systems. And just one more thing I wanted to go back to that Dr. Palmer had mentioned, which I think is so important, this idea of guilt with caregivers. So much of it is just because there's little knowledge on what to do next or how to handle this. And I think I've seen this plenty of times that caregivers just need a little bit of permission, from care providers to take care of themselves, right? So I cannot tell you how many times I've said to family members, it is okay. It is okay that you're exhausted, let's point you in the right direction to get some help. So I think guilt plays such a big role in terms of caregivers. So I just wanted to come back and and touch on that. You know, we as geriatricians or geriatric care providers, I think, recognize that. And I just wanted to say that for the audience members here.
Absolutely.
Thank you.
Thank you so much.
Yeah. Thank you, Dr. Nagar. I think one other thing that just to kind of elaborate on that thought process, you know, indeed, I see family members that feel like, okay, once I've got the answer, once I've got this program in place, good, I'm set, and we'll continue to do this. And I always try to encourage people to understand that for most people, this dementia, this neurocognitive decline is progressive, and we don't know how long, and we don't know how rapidly it's going to progress, but understand that what we're doing today, if it works, great. And we're going to take today, we're going to focus on doing the best that we can and enjoy this day with our family member. But then when things change, we'll adjust our program. We'll change with it in order to continue to do the best that we can. But understand that the change will happen.
Absolutely. Well, I think this is just kind of a good note to end on, and letting folks know that, you know, this is a process, and we're all in this together, and there are resources not only for your family members, but for you as well. Are we having some back and forth audio issues? Am I? I think
Sarah,
we might be.
We can see and hear you.
You're still there.
I'm still here. Okay,
Yep.
Wonderful. Good. Well, we are very thankful to all of you for joining us today. And just, again, want to emphasize that Prisma Health is here for you. We have resources for your family members, for you. We have a great team ready to care for anything that you and your family may come across in this space. So again, thank you for spending an hour of your time with us. Thank you for listening to our experts. Thank you to our experts for sharing what you know. And we look forward to seeing you guys next time right here on Facebook on our next topic. All right. Everybody have a good afternoon.
Thank you.
Thank you.
Thank you very much.
Thank you.